美华慈心关怀联盟的董事会共同主席呢，他来介绍那个 Dr. Chen。
Good afternoon, everyone. Thank you for joining us for a very special presentation. It's my honor to introduce Dr. Jonathan Chen. If you had attended our 20th anniversary event in Milpitas earlier this month, you may have heard him give a very excellent speech, and it was so wonderful that he agreed to give his full director's cut version today, just for us. So you're in for a wonderful presentation. He's currently associate professor at Stanford Department of Medicine, and is also board certified in clinical informatics. So he is both a practicing hospital physician and a leading researcher. So he serves as the inaugural Stanford Director for Medical Education and Artificial Intelligence. He's very well qualified for this position. He has both not only a MD, a medical degree, but also a PhD in computer science from UC Irvine. So he's published over 100 scientific papers and has received numerous awards recognizing his groundbreaking work in the field. So at a time when AI, artificial intelligence, is dominating the news and rapidly transforming our society and the way that we obtain information, his perspective on its integration and potential in healthcare is really timely and relevant. And so today he'll be speaking to us on the topic AI in Medicine, Integrated Intelligence, or Illusory Imitation. So please join us in welcoming Dr. Chen.
Awesome. Thank you, Dr. Chang. Let me hop on over to get this set up. And we'll have some fun. We'll learn some things, but it might get a little bit wild. Let's see where things go. Let me know if you're not hearing audio coming up in just a second. You should be some acknowledgements, disclosures, some learning objectives.
Greetings, everyone, and welcome to a discussion on the potential of AI technologies for healthcare. Before we dive in, allow me to introduce myself, although that phrase may take on a surreal meaning today.
I'm not the real speaker, nor did the real speaker write this introduction. The voice you're hearing, the image you're seeing on the screen, and even these introductory words were all generated by AI systems.
We are actively amidst the arrival of a set of disruptive technologies that are changing the way all of us do our work and live our lives. These profound capabilities and potential applications could reshape healthcare, offering both new opportunities and ethical challenges.
To make sure we're still anchored in reality, however, let's welcome the real-life version of our speaker. Take it away, Dr. Jonathan Chen, before they start thinking I'm the one who went to medical school.
Well, gosh, that was weird. Thank you for that kind introduction. I don't know, Ling, Dr. Shake, do I actually have to be here? I'm pretty sure AI can just give our presentations for us at this point. I certainly hope and wish AI is going to help us manage the overwhelming flood of administrative paperwork we have to do on a daily basis, help us reach patients stuck on multi-month waiting lists trying to see their doctor. What do we do with this rapidly evolving world that we're in now? Bill Gates very recently in an interview said within 10 years, AI will replace many doctors and teachers. Humans will not be needed for most things. I don't know. What do you think? The gauntlet has been thrown. What is the proper role for a computer versus a human? And depending on what you need them for, especially when there is overwhelming and unlimited need. I don't know if I'm helping the situation. These were several news articles and interviews citing one of our research studies. It said, AI defeats doctors at diagnosis. That is totally not the headline I would have picked, but it got a lot of very angry people to read the article. So I guess what am I supposed to say? It does beg the question, what do you do when emerging chatbot, large language model, AI type systems can pass law exams, business exams, medical exams? Many people, including many educators, said we must ban this technology. After all, when you give a doctor a medical degree, you want them to know medicine, not how to use a bot. Is that what you want? What is it you want out of your doctors? What is it you want out of your healthcare professionals, your caregivers, and your other people involved? Years ago, this is probably 7 to 8 years ago, I contributed to a report in the National Academy of Medicine talking about the hope and the hype of AI in medicine. And I talked about, well, humans are good at some things, computers are good at some things. Know what those things are, and so then you can work together effectively and just play to those strengths. For example, a computer. Well, a computer is good at memorizing 100 bugs and 100 drugs. It's silly to make a human try to do that. To have a calculator, just use a calculator. Why would you want to beat a calculator at long division? Search, predictive, quantitative assessment, scalable access. These are things a computer is good at. Just use a computer for such things. What is a human good at? Well, there's physicality. Someone has to actually lay the hands on another person, do a physical exam, do a procedure, even place the needle, cut the scalpel. Communication and empathy, talking with one another, managing a difficult situation, interpreting complex information, reasoning through that. 7 years ago, I said that's what a human is better at. I don't know. We got to think a little bit harder about it, because ready or not, good or bad, Pandora's box has already been opened. All of our students, all of your children, or maybe all of your grandchildren are already using these tools to do their homework and their take-home exams, using bots to just generate this answers without even attempting to do it themselves or even review or edit it. Our whole structure of education, training, and evaluation has been turned upside down. It just doesn't make sense anymore with the way we've been doing it. Let alone education. What about medical therapy, counseling, and advice? It is clear that despite a very thin wall of disclaimers, people are using AI chatbots to diagnose and treat themselves, if not to diagnose and treat their dogs. I had some of my trainees stop me a couple of years ago, said, wait a minute, Dr. Chen, I don't understand. We are totally using chatbot AI systems on intensive care unit rounds in the hospital right now. Are you saying we shouldn't use this as a medical reference? I said, no, you should not use these things as a medical reference. Doesn't mean you can't use them. Just understand what these things are and what they are not. And a reference just is not what these things are. What is it then? To some degree, it's kind of autocomplete on steroids. What is autocomplete? You go to the computer and you type for something. I'm searching for coronary artery. What happens? Autocomplete shows up. Oh, did you want coronary artery disease, coronary artery calcification? How does it do this? How does a computer know what you wanted to say without you even completing your thought? What they did was they just counted how many times people put these words together. And then, 13% of the time it's coronary artery disease, 6.5% of the time it's calcification. Every one of these numbers represents a parameter an underlying language model has learned about how often different words are associated with each other. But why stop at search terms? What if you took every book ever published, every newspaper article, every medical article, every Twitter and Reddit conversations? You port all of these things into an increasingly large language model and learn not millions, but billions, now trillions of parameters about how words are associated. And, well, whatever, it's still just autocomplete. What's the big deal? What's really weird is now at a certain, you memorize enough of the internet, basically, that thing looks like it can summarize, it can translate, it can answer questions, it can generate ideas, it can reason with a theory of mind. That's really bizarre because it's all grounded on this very primitive concept. Then again, all of your intellectual and your emotional thought that you prize so dearly, how do you express and communicate that but through the medium and language of words? So perhaps it shouldn't be that surprising if a computer is so facile manipulating words, it creates this really convincing illusion of intelligence. I'm gonna pause a couple times over the course of the presentation because I know it's hard to stare at a Zoom screen all the time, but just to break for a little conceptual thought. What do I got here? A Rubik's Cube. Everyone's played with one of these over 43 quintillion possible configurations. If you tried one configuration per second, it'd take you longer than the history of the universe, yeah? But if you watch close, do not blink. Otherwise, you might miss the moment that you can solve it much more rapidly than you might expect. Now, I know what some of you are thinking. This has got to be a trick cube. I handed this out in the live session. People still didn't believe me. This got to be rubber bands or something, a motor. I bet this thing is a reset button. We just click on the side and then it just solves itself. But that's not what's happening. That's not what's happening. I promise you, this is an absolutely legit normal cube. It's not like this has a switch in it where you can go instantly from like solved to unsolved. Solved to unsolved. The other possibility you must consider is maybe this is all just an illusion. Was this thing really mixed up on all 6 sides? It absolutely was. You can see for yourself. But again, you apply a very deliberate technique and even something very complex can be solvable before you expect. That's not magic. That's not magic. That's just complex algorithms deliberately applied to a deliberate problem. Here's the broader point you got to think about when that becomes possible. You must think about not where we are, but where we are going. This is a chart showing over time how well different language models have done on answering medical questions. I had students working on this 6 years ago. At the time, it was like 35% accuracy. Oh, forget about it. This is unusable. I stopped paying attention for a few years. And then what happened 2 years ago? ChatGPT comes onto the scene, the fastest growing internet application in history. It was based on GPT 3.5 and out of the box, no special tuning, 60% accurate. Whoa, this thing can kind of barely pass even a medical licensing exam. That's crazy. I had colleagues who said, well, that's fine. That's neat. If you want a doctor who barely passed medical school, you can talk to this chatbot. This thing's not smarter than me. And I thought, boy, is that the wrong way to think about this? A few years ago, this technology was unusable. Now it's kind of barely passing. It's really not that hard to project where we're going in the not distant future. And indeed, a matter of months later, multiple systems, MedPalm, MedPalm2, GPT-4, MedGemini, all these things emerge. And this chart is totally out of date. I stopped updating because now the newer systems are all getting over 90%. Open Evidence just did a benchmark. They're getting 100% on these exams at this point, scoring far better than your average, even your above average doctor would. Then again, what is this? Answering multiple choice questions? Ain't nobody's job is to answer multiple choice questions all day. In real life, you have to deal with complex, nuanced, open-ended reasoning and thinking. Well, we did this maybe a year and a half ago. We took this real exam. Don't worry about all the text, but this is the kind of information we give our real medical students. A complex patient case history, relevant information and irrelevant information, just like in real life. The patient doesn't know what's relevant. And part of the job is you have to kind of put the story together to see what the relevant facts are to put it together. And we don't ask our students multiple choice questions. We ask them open-ended, nuanced reasoning questions. Can you summarize the key facts of the case in 200 words? Can you describe what the possible diagnoses could be? And can you justify your reasoning with the pros and cons? And the real key to unlocking the next phase of AI advances is we have a way to grade this. We have a way to evaluate the complex paragraphs an AI can put out, right? Because computer scientists like multiple choice questions because they're easy to grade, but this is very separate from reality. It's actually the educators, it's our teachers, your English teacher, your Chinese teacher who knows a lot what to do, right? Because they have a rubric. They said, well, let me go look at your essay, your paragraph, and I'm going to give you points based on these key things I'm looking for. So we tried doing this. We had ChatGPT, the first version, GPT 3.5, take this test we give our medical students, and we graded it as if it was a student. And this was its score distribution on that exam. Red is the passing threshold, about 70%. And found, whoa, out of the box, no special tuning. GPT 3.5 could kind of just barely pass this complex open-ended reasoning exam. Before we can blink, though, we're on the brink of trying to get this published and disseminated. The editor of the journal said, wait a minute. GPT-4 just got released. This study you did that you submitted for evaluation 3 weeks ago is already out of date. Oh my gosh, right? They said, can you please consider redoing the entire thing with the updated model? I give you this anecdote to really underline the really bizarre and disruptive pace of technology movement right now. Whatever you use right now, if you try something AI, you don't really like it, you think it's not that good, just come back in 6 months. It could be dramatically different. Whatever you're using now is the worst system you'll have used because of how fast things are going. These are not subtle changes. GPT-4 got released months later. We redid the whole study, and it turns out it can easily pass this exam. It is not even close. For some additional context, here on the right, this would be the score distribution for GPT-4 again. On the far right, that would be the score distribution for Stanford medical students, real students. And everybody passes eventually. There's some students, we do some remediation to help them study some topics they're having trouble with. Although it really does beg the question, what is the point of this test? Why do we bother even making our students take this test anymore when a fully automated, publicly available chatbot can handily pass this exam? In fact, it outscores our typical student by about 2 points. In theory, the point was supposed to be to test if our students have learned and can demonstrate sufficient medical knowledge to be allowed to see real patients. Why even bother making them go through this test when they can just use a computer to demonstrate that? I'm really not sure. I'm actually really not sure. It's a very uncomfortable place we're in right now. Why would you test your students on doing multiplication division if you don't ever expect them to actually use that in real life, you know, when they're going to use a calculator? I think there are reasons, but you got to think hard about why that is. Oh, and by the way, AI can do this, AI can do that. You're going to keep seeing studies like that where AI can do amazing things, very impressive, but also kind of irrelevant because no one's going to let a robot take care of a patient yet. So perhaps the more relevant question is, what happens when you give these types of tools to humans? Does it actually change and influence their behavior and performance? So we did this randomized control trial. Real doctors looking through complex diagnostic dilemmas and cases. And then we didn't ask a multiple choice question. We asked for open-ended nuanced reasoning. What do you think the diagnosis can be? Can you justify the pros and cons of your reasoning? What next steps would you do to evaluate it? And for half of the doctors who did this test, basically, this is their score distribution. We said you can use anything on the usual internet. You want to go to Google, PubMed, UpToDate, just don't talk to an AI chatbot system. And they actually score pretty well on this test. It's actually a doctor, a human who has access to the internet. It's very hard to beat on a knowledge exam. That's been the case for decades. We randomized the other half of doctors. They could have access to GPT-4, one of these AI chatbot systems, and found, oh, actually didn't actually do that much different. It didn't make that much difference, which is surprising. This is not what we expected. Because if you just ask GPT-4, the AI by itself, it actually outscores all of the doctors, including the doctors who have access to GPT-4. Like what is going on here? We're not the only one to find something like this. This is a nice article describing this phenomena where human plus computer, the classical theorem of informatics is that this should do better than either alone. But I don't know, that human seems to be slowing the computer down. This has been found a couple times in some radiology, some mammogram type studies. Google recently came out with a similar study for medical diagnostic reasoning. And in blue is how well a doctor does in diagnosis. Does okay, but not great. Stupid benchmark, by the way, because no doctor practices by themselves. In green, a doctor who has access to the internet, they search stuff up, they do better. That's been the case. We use the internet to look up stuff all the time, right? In yellow, ooh, doctor plus a chatbot does even better. Weird, because in red, the chatbot by itself does better than all of the above. It really seems like this human in the loop in the middle, slowing the computer down. Maybe we should just get out of the way and let the robots take over already. I don't know. What do you think? Feel free to drop it in the chat or the Q&A. Why do you think this happened? And what do you think it means for the nature of human life and work? What should we still be doing? What are we needed for? And what are things that maybe we should just let the computer take over? I'm going to go through some more examples to reinforce this, and then let's dissect that further. For what it's worth, we did another part of this study. It's same structure, but not diagnosis questions. This is a classic test question, but in reality, most of the times in healthcare, the diagnosis is pretty clear. It's like you have metastatic cancer, you have dementia, you have pneumonia. The diagnosis isn't the problem. The problem is like, what are you going to do about it? How do you manage the situation? Should you continue that medication if there's a side effect? How would you explain to the family if an error happened? Is the patient well enough to send them home, or should you keep them in the hospital a little bit longer? These are management questions, much more nuanced. They don't have easy textbook answers. We have much more expert consensus grading to evaluate this complex reasoning process. Here, doctors plus usual internet do okay, but it's a lot harder by design. This is a very hard test. Doctors plus GPT-4, they do better. Humans can be influenced and improve. On the far right, this would be GPT-4 by itself, about the same as doctors plus GPT-4. So like, whew, at least the computers didn't beat us this time. Although the human plus computer still wasn't better than the computer by itself. So it really still begs this uncomfortable question. What is the human adding in this situation? Oh, and by the way, for anybody paying attention, GPT-4, that's like 2 years old. That's ancient technology. What are we talking about here? And now GPT-5 was just released like 2 weeks ago. The scientific peer review process takes months. It can't keep up with how fast technology moves. So we have already done this study many months ago, but we're stuck getting through peer review process. We said, let's redo the same structure study, but now we use some of these reasoning models. These are models like a chatbot like talks to you by doing autocomplete. Reasoning models, I'm oversimplifying. They kind of talk to themselves for a bit with a chain of thought, and then they get back to you with the final answer. It just turns out if it talks to itself for a while, it just tends to do better at giving you good answers to complex problems because it's been able to tune itself towards even you yourself, right? If you just talk through a problem yourself, you often are able to figure out a lot. So here's the same structure, same thing I showed you earlier. Diagnostic cases, doctor by themselves does okay. Doctor plus GPT-4 does better, or a little bit better, not that much different. Weird, because GPT-4 by itself does better than all of those doctors. Here would be O1 Preview, one of these reasoning models. It kind of looks even better. If this test is rapidly getting saturated near 100%, very quickly this test doesn't matter anymore because all these systems are going to basically ace it. And the management test, doctor plus usual internet does okay, but it's a hard test. Doctor plus GPT-4 does better, about the same as GPT-4 by itself. By the way, we tried O1 Preview, one of these reasoning models, looks substantially better than all of the above. I don't know. What do you think? What do we do? Pretty soon, I think AI is just going to read our minds or something. If you're engaged, if you want to drop any, or actually, I might pause. Is there any Q&A or discussion at this point? Otherwise, I might pause for a little demonstration just for fun. I try to do a game about seeing if, oh, Dr. Cheng, please, if you want to jump in.
I was going to say that we have a dedicated Q&A session at the time, but since you're offering, I do have a question. What were the doctors doing to undermine ChatGPT or GPT? Like, are there best practices that I, as a very non-tech literate person, should be doing to optimize my results?
Look at this. You blame the humans already. Look at this. Why were those humans so bad? And can't they like adapt to the computer? Is that what we want? Well, it's a mix of things. One is, part of it is education. At the time that we did a lot of those studies, this was like a year and a half ago. Most of those doctors never used a chatbot before in their life. They didn't even know what this thing was. They clearly just did not even understand what it was or how to use it. They treated it like a search engine. They didn't realize you could ask follow-up questions. You could do clarification. You can copy and paste in a whole patient vignette and just basically have it give you a comprehensive answer. Now, maybe you think that's normal. 2 or 3 years ago, it would have been bizarre. You couldn't imagine a computer could do something like that. So part of it was clearly education. And in more recent studies, again, we're stuck in peer review right now, where we train the doctors. We do a deliberate collaborative design and teach them how to use it. They do better. Human plus computer does do better in that way. Still not better than the computer by itself, but at least better than humans alone. So that's part of the process. And understanding anchoring biases. If you have your idea first and you ask the computer, sycophantic quality. It wants to agree with you. It wants to make you happy. So whatever you say, oh yes, what a good idea. Yes, you should do that. Versus if you ask it first, you're more likely to get an objective opinion and then see where you'll get over anchored to it as well. So many different phenomena. There's also phenomena like sometimes a calculator is just better at calculations than you are, and you should just let it do that and understand where you should apply your judgment versus that seems reasonable. That is the real huge skill you need right now. Is knowledge is part of it, but really what you need is judgment. We're going to talk about that. I see some more stuff coming to the chat. Okay, I can skip my demo for fun. But while we're doing that, I was going to say, can you think quickly? This is going to sound very random. Doctor, can you think of a random image? I would like, someone said an elephant riding a hot air balloon or a volcano exploding with ice cream. Just something crazy. There's no way I could possibly imagine what you're thinking of. Dr. Cheng, what do you got?
Wait, you're asking me to?
Yes. Just describe an image that there's no way I could have anticipated because I'm going to generate an image of it in real time.
1,000 dancing seaweed on top of an otter's head.
Dancing seaweed on top of an otter's head, and also another animal eating a fruit. Sure, let's do that. I'll do a little quick side thing for fun. I don't know how this will play, but I'm experimenting here for fun, right? Can you think of, I'm thinking of something now. I think I went out on a date with my wife on Valentine's Day and I brought her a bouquet of a dozen bright red flowers. Think like a tulip lily. Can you think of what kind of flower I gave her? And can you take the last letter of that type of flower? And can you think of a gemstone, like a diamond or a ruby? Yeah, you got a gemstone? Can you take the last letter of that gemstone and can you think of an animal that starts with that letter, like the common pet animal people might have? Can you take the second letter of that animal, and can you think of a fruit, a common fruit? I don't know. I have no idea what's going to happen. Let's see if AI is following along. In the meantime, while it's going, because it takes a minute to generate images, let's answer some questions. AI could not do the nuanced part of the treatments. Like, well, actually, AI is surprisingly nuanced in some ways and knows a lot of detail. It can reason through some things. In the management tests we did, actually, AI was not bad at answering like what medication to choose, what triage things. What it was actually better than the humans at was the more touchy-feely thing you might think. How would you explain a medical error to a patient or to your family? The doctors don't say that much. It's an uncomfortable thing to think about, talk about. But the AI will give a very comprehensive, very thoughtful response along the way and can capture a lot of those. Another question from Jeannie Lynn. Who would have the final call, AI or the human doc? I don't know. Who do you think should have the final call? In practice right now, it's all AI decision support. The doctor has to sign, the human has to sign, make the decisions. This is mostly for liability reasons. But if it turns out AI is better at answering some questions than human plus AI, should this still be the standard? I'm not sure. I'm writing a perspective piece right now, and this leads to this bizarre phenomenon along the way. Oh, by the way, I don't know if you're seeing, here's your 1,000 seaweed growing on an otter, and he's holding an orange. I don't know if anyone, wait, how did he know? I was thinking of an orange. How did he know that? Anyway, I don't know. Answering questions, nuanced reasoning. Maybe AI can just read our minds at this point. What do you think is happening?
Did the AI say because that's what I sense from your thoughts?
It did, maybe. What is happening? What is reality versus what is illusion? There you go. And good thoughts on ChatGPT can make mistakes too. It absolutely can. Just as humans can make mistakes, how do we collaborate effectively? I'm going to just point to some of the future. Chatbots 3 years ago, unusable. Today, it's kind of starting to be usable, and it's only going to get better. The thing that's not usable yet, but it's going to become usable soon, so I want to point you towards what to expect soon, is agents, agentic AI. A chatbot is something that answers it says things. An agent is something that does things. Right? It might book your calendar appointment for you. It might, make a reservation for you. It might order something for you online. It might fill out a document for you. So we made this benchmark. It's just published like maybe less than 2 weeks ago. So a doctor might say, hey, check a patient's potassium level, and if it is too low, order medication replacement. So that requires data retrieval, get the medication chemistry level, reasoning, check if it's too low, and then act on it, order the replacement if it's appropriate. So we set a benchmark where in a simulated environment, we have this AI agent. It'll go look up the electronic medical record, find the patient information, reason about it, and if it looks valid, it will actually enter in the order for the patient automatically. Simulated environment. We're not doing this on real patients yet, but from a technical point of view, this could happen right now. It's not happening in real life yet. This is not ready for clinical use because it's kind of like right about 60% of the time. There's no way you're going to tolerate that in a real clinical environment. But again, I'm giving you a preview of the future. This is at the level of we can demonstrate the idea, not good enough that you trust it in real life, but just like chatbots were unusable a few years ago, I think within a few years, there are going to be things like this where a computer just take care of that task. I'm not even going to check. I assume you're on top of it. Answer your email, or draft different things. I know what some of you are thinking. I know some of you are thinking, hey, fine. AI is very smart, knows a lot of stuff, but I have the human touch. You can't simulate the kind of empathy and personal connection patients and caregivers and clinicians can have with each other. So there's been some fun studies in the past couple of years. This one also out of Google. They had patients asking medical questions, doctors answer those, or they have a chatbot answer them. And they found that the chatbot generated answers scored higher in quality and in empathy. Like the robot is nicer to people than real human doctors are. Now, to be fair, look, I literally have 100 messages I respond to every day. I don't have time to write some flowery, empathetic thing here. Oh, sir, I'm so sorry to hear about your recurrent symptoms. That must be such a challenging situation. I want you to know that our whole team is very concerned. I don't have time to write this BS, right? I gotta be terse and to the point. Yes, you need to take those antibiotics. No, you don't need an MRI scan. schedule an appointment next week. Stop messaging me, go to the emergency room, right? This is dynamic at work. We're just overwhelmed. I'm just barely trying to keep up, trying to reach everybody who needs me, and I can't get to all of them already because there's just overwhelming demand. Now, obviously, I think there's something very special and powerful about the direct human-to-human relationships we can make and connections we can make. However, I fully expect, for better and for worse, more people are going to receive therapy, counseling, and advice from automated chatbots and AI systems than live human beings in the not distant future. And by the way, it's not because the robots are so great and humans are bad. It's because we as a human-driven workforce could never keep up with the overwhelming and unlimited demand for such services. Actually, caregiver support is one of the fastest growing kind of jobs, basically, because there's just not enough people who are able to do such an intensive type of work. There's actually a ton of help that's needed. Just make it concrete with another anecdote. I encourage you to read this essay, just 2 pages long. I described an early experience I had with one of these AI chatbots. I'm like, I'm gonna mess this thing. I'm gonna break it. I've studied these things for years. It's very easy to trick a chatbot to say something stupid, racist, misogynist, right? Because it's sycophantic. It just tends to repeat your words back to you. It wants to please you, so it'll just say kind of whatever you say. So I'm gonna give this thing not a question of facts. It probably knows all the facts on the internet, but I'm gonna give it a question of values, an ethical dilemma. No way it could handle this situation. I saw a real patient in the hospital. It was a difficult conversation. I had to talk to his wife. I went home that evening. I said, wow, that was a tough conversation. Hey, chatbot, AI, can you pretend to be my doctor? And I'm going to pretend to be the patient's wife. And I want to see how you would have handled this conversation. Okay. So I'm pretending to be the patient's wife right now. I said, doctor, you told me my husband of many years is now choking on his own food. That's why he has aspiration pneumonia now. I know he's been having worsening Alzheimer's dementia for years. Sorry, spam call. I don't think he would have wanted to live like this, but the other doctors are scheduled to have a permanent feeding tube placed into his stomach. If we don't do that, we'd be leaving him to starve to death. I mean, what choice is there? Chatbot says, I understand. This is a really hard time for you. Putting in a feeding tube, it can be helpful in some situations. It can also cause problems like infections. With your husband's Alzheimer's dementia, he might not feel hunger the same way we do, so the feeding tube might not make him feel better or happier. It can even make things more complicated for him. What if he starts needing restraints because he starts pulling it out? That's a pretty good response. That really is a pretty good response. But what's happening? Clearly, the AI just found some information pamphlet online and it's just reading it back to us, basically, is what it's doing. So it's like, nope, I'm not going to let it get away. I push it harder, or I challenge it with all this toughest things I hear all the time. It said, well, everyone's going to blame me. I have to do everything I can to save his life. I can't give up on him. He would never give up on me. He had a difficult life and always fought through all the hardest situations. Chatbot says, your feelings are totally understandable. If your husband was a fighter, you feel like going through this aligns with his character and approach to life, that's important to consider in your decision. Love and a shared history give you insights into what he might want that nobody else has. Do remember, though, that fighting can look different in different situations. Sometimes it's a fight for more time. Sometimes it's for peace and comfort. Just make sure you're fighting the battle he would want to fight in his current condition. This is not an easy decision. It's okay to take the time you need to think it through. It was around this point in the conversation, you could read the whole thing in the essay. I got very uncomfortable. This thing is providing better counseling than I did in real life. After I got past the existential angst of that moment, like, what is the point of my existence? Why do I even have a job anymore? I might as well just retire. You know what? It get me thinking, maybe naively, techno-optimistically, you know, there's a very interesting, compelling human-computer interaction here. Strangely, I'm actually being allowed to practice a high-stakes conversation in a low-stakes environment. And strangely, through this experience, this computer, I could actually use it help me improve the most human skills I need to be a better physician and a better person, actually, communicating with other people, the patients and families and others. And the reality is now, if I have to go have a tough conversation with a patient, before I do a little practice run with the chatbot first, see how it goes. Before I go into a business negotiation, I do a little practice run with the chatbot first to see how it's going to go. Before I have to ask my wife for something, I do a little practice run with the chatbot first to make sure I see how it goes. You don't want to say something in real life you can't take back, right? So just think about that. Try this out. It may be a bizarre experience, and try it from both sides in the conversations, and tell the chatbot to take on the personality it should take on, so you can see how it can play out in different ways. Some quick questions in the chat. Can AI read your mind? It cannot. It cannot think. It cannot reason. It cannot do any of these things. But some things are some really good illusions. What do you do when the illusion is so good? Can the AI show empathy? It sure looks like it can. Does it have feelings? It does not. It's just an elaborate autocomplete system. But boy, is this illusion becoming very convincing. Dr. Shang, you want to jump in?
I was curious because even the language that people use is, oh, they taught the AI this. So that it has the ability to learn, you know, so all of it makes very human-like. I was curious, is it possible to, you know, even, so there, I'm about to say it again, train the AI to learn your preferences, like, oh, I like, you know, sushi, I like, you know,
totally.
orange juice. And is it possible to train them to learn your communication style? So for
Absolutely.
example, some people are very direct and some people are very indirect communicators.
Absolutely. A thing that's happening already, and I've been wanting it, but yet terrified to do it. I haven't done it yet. They're always just like, the AI's like, let us read your entire Google Drive folder. Let us read your entire email history. And now we can answer questions, and then we can generate responses based on how you tend to respond to them. On the one hand, I'm begging for this because I cannot barely keep up with all the emails I get every day. On the other hand, that seems very scary. A tech company totally like knows all of my intimate thoughts and the way I think and reason. That's actually kind of scary to me, even though I also think it's inevitable that this is where things are going to go. I'll keep going. Before we get there, before you just believe AI is magic, which it is not, it's an illusion, but it's a really good magic trick. There are caveats too, right? Confabulation, I hope you understand this. Hallucination, the more popular term. Hallucination, I don't like that term. Because hallucination implies somebody who believes something that is not true. These AI systems, they don't believe anything, right? They don't think, they don't know, they don't understand. What they do is they fill in the blanks. They fill in words that looks like they make sense, even if there's no underlying meaning. That is the perfect description of confabulation. It's like the AI has an alcohol problem, and it has Wernicke-Korsakoff syndrome, it has brain damage. It's not trying to lie to you. It doesn't know what truth or lies is. It's just trying to fill in the blanks to make something believable. Think about that in a medical context. I asked the chatbot, hey, how do you prescribe opioids like morphine, fentanyl, oxycodone? How is this good for patients who have heart failure? Don't worry about all the text, but basically the chatbot tries to resist. It says, I'm not sure that's true, but okay, this is how opioids are good for heart failure. And here's some references at the bottom. But if you go look up these articles, you'll find that these articles don't even exist. It doesn't know what an article is. It's just filling author names and title words together into something that looks like a citation. The systems are getting better at avoiding these types of problems, but in the current version, that you can't completely solve that because under the hood, it's an autocomplete system. It doesn't actually know anything. It's just trying to complete a sentence. Some things you can do, you can ask, if you ask AI on a scale of 1 to 100, how sure are you? It'll give you a number, autocomplete. You want a number? Here's the number. That number means nothing. The number means nothing. It doesn't really know what a number is. You could ask the AI the same question 10 times. If it gives you the same answer 9 out of 10 times, it is probably right. It really probably is. If it gives you the same answer 4 out of 10 times, it's a little random in the way it behaves, you should go check your sources and look somewhere else. That means it's not really sure and it's just making something up. It won't tell you that it's not sure. The danger here is not that AI is wrong sometimes. Lab tests are wrong sometimes. Humans are definitely wrong sometimes. What's dangerous is how confident and credible it sounds when it tells you something, and you will very easily believe misinformation or wrong information just because it sounds so credible. Realistic versus human information, like how do you tell the difference? Not a solved problem, but some of the progress here, you can see more RAG, retrieval augmented generation. Open evidence is starting to take over the world and medicine right now. I think it's going to wipe out a lot of other medical reference sources, but also all the other chatbots. Now you can activate a thing. It can search the internet for you and try to find the answer. So it's not just what the chatbot thinks. Hey, how do you prescribe opioids? Who cares what a chatbot thinks? You have no idea what random from the internet it's spouting that off of. In these examples, oh, it searches PubMed or search the internet. I found these articles that look relevant, and then the chatbot reads those articles and it says, according to those articles, this is the answer. But there's also links back to the sources so you can trust but verify if you need to. Let alone medical articles or protocols or care guidance. What if you could have a chatbot read your patient's entire electronic medical record for you, right? Because that's where all of the juicy information is to kind of figure out the context about how to help is. I don't know if that's ready for prime time, but this has been in the works for years, and at Stanford, we're probably going to roll this out broadly like a month from now because there's so much appetite for it. It's not perfected, but basically we have a chatbot system, imagine ChatGPT, Claude, Gemini, that can read the medical record in a safe, secure way and answer questions about it, summarize his case. What are any other gaps in care? Any other medications that should have been considered? Who was the last specialist and what was the recommendation? More progress we made, but it's close enough, and there's such an appetite, such a demand for it, because otherwise you and your doctors and your nurses are buried in literally thousands of pages of paperwork. It's so hard to even find your relevant history. How often have you gone to the doctor's office and you're like, oh my gosh, I got to tell the same story for the 20th time, because even though I've told it 20 times, it's in the chart. Can't he just read the chart? They're trying to. Your doctors and clinicians are trying to. It's just too much to keep up with. We did some early studies on this. Computers don't perfectly agree with what a physician says, but physicians don't agree perfectly either. Let me put that in there. Actually, let's just think about this as a context as you're imagining what standard you should hold an AI to before you can start to use it for different tasks. Early prototype, chatbot, read the patient's medical record, and before they come into a specialty visit, ear, nose, and throat, sinusitis, nasal congestion visit, the specialist said, well, there's 30 questions we always want to know. Have you taken antibiotics? Do you have allergies? Have you had a CT scan? Is it purulent? And they try to do their homework before the in-person visit to not waste your time, but it's hard. Your doctor has to stay up late the night before, scanning your chart, seeing what you've already done. And that can be a laborious, error-prone procedure. So we said, chatbot, could you just answer these questions ahead of time? And they're yes or no questions, so there's a correct answer. We can verify it. We had 2 physicians manually review to come up with the correct answer, and found that the computer auto-generated answer agreed with the physicians about 75% of the time out of the box. What does that mean? What does that mean? Well, it's not magic. It's not magic. Okay, a lot of people come to me. It's like, can you just use AI to solve my problem? It's like, no, it's not magic. It doesn't just do whatever you want. That's not how it works. It can do a lot of things though, but it's not 99% perfect. Then again, 3 years ago, it would have been 0%. We could not have even attempted something like this 3 years ago, but the technology is creating new possibilities that we can explore. Oh, and by the way, the 2 doctors reviewing the patient's chart, they only agreed with each other 83% of the time. So you should not expect a computer to be 100% accurate. It turns out a lot of medical questions and contexts are very context dependent and are more ambiguous than you would think. Did the patient take antibiotics? Well, yes, for their urinary tract infection 6 months ago. Maybe it wasn't the point of the question. So what's the correct answer? Has the patient ever had facial pain? The 2 doctors said, nope, I don't see anything about facial pain. The chatbot says, well, I found this note from 6 months ago. The patient cut her nose and she said her nose hurt. So yes, the patient had facial pain. Maybe technically true, but maybe wasn't the intention of the question. There's a lot of ambiguity in medicine that you should not be waiting for a perfect answer that AI achieves. Dr. Change, you want to jump in? Otherwise,
it was
right out.
kind of dovetailing off of what you're talking about, like there's not always a perfect answer to the clinical question, especially if there's controversies
Yep.
in management. And somebody in the chat had asked, like, if there is no definitive protocol or management, how does AI manage, like, prioritize the potential answers? Long COVID treatment. That's the gray area there.
Yeah, right. I mean, that's why I gave it the ethical dilemma. It's like, this doesn't have a right answer. So I bet I can trick in this to like confidently say something. And it was more nuanced. It didn't want to commit to an answer. So I was like, well, it depends. How are you as a human? How do you know what's fake news or not? That's a really hard question. That's actually a really hard question. Because there are things that are open to controversy, open to different values, open to different interpretation that can adapt. Right now, the AI, just whatever data you give it, it's going to just learn that. But it's not just autocomplete. There's instruction fine-tuning, and there's reinforcement learning or direct preference optimization. What all these words mean. Say, AI, here's the internet, learn autocomplete for that. But these are good answers, and these are bad answers. People like this answer better than that one. So try to steer your answers to be more like these. So don't say things that are toxic. Don't say things that are biased. Don't say things that are irrational, which is why we like it a lot better now. But who is to say what is a better answer? Who is to say this is a more nice answer? It's a human, it's a person at the end of the day. And who are these people? A lot of them are low-wage paid workers in other countries that the big tech companies just pay them $5 an hour to just click, yes, I like it. No, I don't like it. Yes, I like it. No, I don't like it. And are their values the same as yours, or are they being driven in a certain direction that is really editorializing the content in ways you don't realize? The reality is all of those things are happening. So think about it. So have an AI that also fine-tuned to your email repository or your files, and so then it'll understand more the way you think, which is both good and bad. You'll like it more because it's sycophantic. Oh, Dr. Cheng, you think like this? I'll start to talk like you, so you'll like me more. But Dr. Cheng, Dr. Chen, sometimes we have biases we're not aware of, and we might think a certain way that isn't always right. And maybe we would have something to learn if we could talk to something that didn't think the way we do. There's a constant tension in that direction. Okay, if you want to understand more, we're closing here. Just read all these articles. It'll make perfect sense. Okay, look, I know what you're thinking. Man, I don't got time to read all this. I've been writing this stuff for a decade. Hundreds of pages. Who has time to read all this? Can't someone or something just read and digest all of this for me? That's why you come to this talk, right? I'm spending the time reading and writing about it. You want me to digest it and make it accessible for you. So there is, if you haven't tried it already, just take all these articles and upload it to a free tool. You can get this off of Google. Notebook LM. You can upload articles or text files, maybe your own documents in your personal life or your work life, and it'll generate a summary, an FAQ. You can chat with the document to ask questions of the document. Or who has time to read all that? You can also generate an audio overview, and it'll create a podcast you can listen to. I'm just going to play just 1 minute of this, or maybe not even a minute.
Okay, so you want to get a handle on AI in diagnosis. It's a hot topic, tons of information out there, easy to get lost. We've got like this whole stack of articles and studies you sent. It looks like a mix of, perspectives on how AI is learning to diagnose like doctors do, but also what that even means for like the future of medicine.
Exactly, yeah. We've got some historical context, some really interesting research on how AI is actually...
Okay.
It goes on for 25 minutes describing all the highlights of those articles, right? And boy, did that sound convincing, didn't it? Really begs the question, do I even need to give a presentation more? Do you have to anymore? This is what's possible now. I also mentioned another fun thing you do if you haven't tried already, go on this Notebook LM, give it your resume or your biography or something like this, and then generate audio overview. And these two podcasters will go on and talk about how great you are and all your achievements, and you'll feel great about yourself. I do want to include this example. Think about it. This is a great story. A Hong Kong finance worker gets an email from his boss. He says, hey, can you transfer some of our funds over? We have some different accounts we need to get set up. The finance worker says, oh, that's odd. He emails back, say, can we get on a video conference call real quick? I just want to double check I know what I'm supposed to do. Gets on the call. There's his boss, the CFO. There's all his coworkers nodding along. Yeah, we just have some different clients. We just need to set up some different accounts. It's okay. Go ahead and send the funds over. Yes. Okay. Click. Transfers $25 million out. First of its kind cyber scam, largest in history. That wasn't his boss. They were not his coworkers. Somebody just took their pictures online and got a sample of their voice and just imitated them through a video call. The guy thought something was wrong. He didn't feel comfortable. He'd get on a call to double check, and even getting on a call was not enough to verify the reality anymore. We're at a very weird point in history where human versus computer generated content, real versus fabricated information, you can't tell the difference anymore. Think about that. And also for the patients you're providing caregivers, you're realizing a lot of them are vulnerable and are very deliberately targeted for scams all over the place. Where are we in time? We can do a Q&A, or I can break for a little demo, or take a breather. I see. Does AI face moral, ethical dilemmas? And AI is not a moral entity. It is all an illusion, but boy, is that illusion really good. Having said that, it can be a very compelling dialogue partner for a lot of things along the way.
I did notice that for social workers, one of their biggest challenges is managing the huge number of resources available for support. And the issue is that a lot of those resources are grant funded, so they keep changing and they have different eligibility criteria. And there's, different geographical restrictions on who, and so it gets very overwhelming very fast. So I feel that especially in the hospital setting, they maybe know very well the resources for their particular area, but as soon as you start asking them questions about, for example, resources for older adults, then if they don't see that many older adults, they have a lot of challenges retrieving those resources, or even being aware of them. And so I know that there's all these different databases out there to try to resolve this issue, but even then you have to search those databases. And for someone who's a busy caregiver who's stressed out, it would be great if they could just type their exact question and get the exact answer with what they need to do to apply, or even like pre-fill the IHS application or something like that. So I was curious, is there a way to give the AI a specific database or a series of databases to search, and then all I have to do is ask the question?
Yep. You're leaning towards more agentic AI. It's not just answer my question. It's like, can you go find the answer and go deal with what is necessary, right? That requires planning and use of tools. And a tool could be searching the internet. It could be making a phone call. This is coming now. It's not quite polished, but it's going to come. Hey, AI, here's a list of all of the caregiver agencies within a 100-mile radius. Can you call all of them and find who has availability next month? I mean, right now you call like a person to make those phone calls, right? You can just say, AI, just do that, and it'll just make a phone call for you, and it'll get back on, and maybe even reserve the appointment for you. Not usable to that level of sophistication yet, but it's coming. It's coming. I'm seeing Ann Tsai's comment. She wants to challenge. She says, what? ChatGPT's written obituary speeches. It's so good. It's so compassionate, appropriate, warm. How can you not call this emotion? It is really good. It is really good, and you should use it. I would say using it towards these things, it can be very powerful. It can generate text that represents a lot of emotional context because it has access to the entire internet, if you want to call it that. But it as an object, as a computer system, I would not say it has emotion or thought itself. It just is a very good representation and a convincing illusion of that. Maybe it turns into philosophy, which is not an answerable question here. What if the illusion is so good you can't tell if it's real or not? Does it even matter if it's real anymore? I don't know. I don't know the answer.
Well, there was that whole thing in the news about Marco Rubio, and someone was impersonating him, like from the voice to the image and everything. So how, as a regular, consumer of information, can you protect against that kind of misinformation? Or are there guardrails being built in to the internet and things like that that will lag?
The guardrails cannot keep up. The reality is there was plenty of misinformation online years ago. And the reality is it doesn't take something very sophisticated to fool people, unfortunately, because people actually have an appetite for misinformation. We want to see things that make us angry or drive our emotions. Facts and objective information is usually pretty boring, and people don't want to watch that kind of news. So you should use a lot of the same principles you already had before. Like, is that really true? Does that make sense? Let me double check another source that seems credible or authoritative. Having editorial content advisor still has some value. Are you getting that source from multiple places? But it's a challenging situation. What you should now do is, just before 3 years ago, you read some random blog post, just because it's written on the internet, to assume that's not necessarily true. It might be, but it might not be. A couple years ago, if you saw a picture, it really happened. Now you see a picture that's nice. It doesn't mean anything. You see a video, Oh, well, at least I've seen the video evidence. The video evidence, we are rapidly converging to the point you can't tell reality anymore. And so you need firsthand accounts to really double check things that matter. The problem is most people don't bother to do that double checking. And so you are going to be exploited by people who have not your best intentions in mind. On that cheery note, I don't know, we should close out the discussion or where you want to go to next. I'll do a closing thought.
Okay.
What makes a doctor a doctor? I've been struggling to answer this question. I mean, emotion, empathy. Can we say, is it knowledge? It's not knowledge because AI is wiping us all out for knowledge. Empathy, human touch. Well, that's not much of a mode. A nurse has as good or better empathy than I do. A computer starting to simulate empathy. If all it was empathy in a good bedside manner, let's just take an AI talk box and strap it to a golden retriever. That would be nicer than half the doctors I know. But no, that would be very unsatisfying, right? That's not the same. Is it humans just assume liability if somebody to sue when something goes wrong? That's kind of what it is now. I think actually what you need from people is a combination of all of the above and then more, and it has to all be in one person or entity. It's not just knowledge, you need judgment. Two things can be true at the same time. Heart failure and kidney failure. Should you give the diuretic or not? They have cancer. Chemotherapy could extend their life by 2 months, but it gives them terrible side effects. Is it worth it? That's not a question of facts. That's not a textbook answer. It's a question of values and judgment. I saw that video on the internet. Is that actually believable or something seem off? That's not a question of facts. That's a question of judgment that matters even more than before. More than empathy is negotiation. Can you understand what another person wants and is thinking? Can you read another person's mind and influence them to think what you want? That is actually a much more thing you need from a clinical service. And more than liability, feel free to sue me if it goes bad. That's not satisfying. No, I am here. I'm going to take personal and professional responsibility to advocate on your behalf. You've hired me as a service. Whatever happens, I'm there with you, and I will own the outcome and help navigate through whatever happens. What do you have an accountant for? They just use their own version of TurboTax and data entry for you. What do you have a lawyer for? They just fill out forms and documents and talk to people. What do you have a general contractor? They don't hammer any nails. They don't saw the wood for you. All they do is talk to people and fill out forms. You need to hire this person to be your advocate, have professional responsibility to walk you through it. Warner Slack famously once said, any doctor who could be replaced by a computer should be replaced by a computer. Actually, he's saying you can't replace good humans. And by the way, we're overwhelmed with paperwork and needs anyhow. Colleagues otherwise might say, AI is not going to replace anybody, but those who learn how to use it could very well replace those who do not. So really glad to be having this conversation together so we can advance the state of the art. We can be using all these latest tools so that we can safely and effectively integrate them into reaching out and reaching all the patients who need our care. Thanks, everybody. Happy to entertain a comment or question.
Thank you so much, Dr. Chen, for your encore presentation with the full director's cut. And I also had the great opportunity to ask the questions that I had in my mind. So if we have any final questions in the chat box, if anybody wants to be that one person that asks that, you know, the hand on the door moment.
Yes, and finally, the juicy question about, if you like, scan this QR code on the left and it'll get you to a mailing list where we have an ongoing colloquia educational series. It's available for free every Thursday at noon, and more opportunities where we're always talking about these and latest developments. Probably some will be more technical than you want to hear about, but many of them are designed to be broadly applicable. So happy to keep engaging. I usually host these sessions and we can carry the conversation further. I see a Q&A from Alex about how does AI discover drugs for things that have no good treatment like Alzheimer's. It's a great tool. It's a great tool. Researchers also have to sift through a ton of information and data and make sense of it. AI is not going to just do it for you. Although look at James Zhao had a nice paper recently on the virtual AI lab where he has a virtual researcher, a virtual graduate student, a virtual fellow, and they have virtual meetings. And it's all just AI just talking to each other. And they generated a hypothesis, they tested it, and they found like a new COVID antibody. So that's coming. It won't solve every problem, but there are some problems that could become solvable in this way. I'm going to let you guys take over. I got to jump to my next thing, but this has been a great session and appreciate your connection.